We are looking at the chest X-ray. There's a crescent of air right beneath the right diaphragm. What does it mean? Hi, welcome to MedInstruct YouTube channel. Today we're going to break down one of the four main types of extraluminal gas, pneumoperitoneum, or also known as intraperitoneal gas. There's no room for gas in peritoneum. Let's break down how free air in the peritoneum or pneumoperitoneum actually looks on imaging. As you probably know, there is no normal air in the peritoneal cavity. So if we see air there, it usually means something went wrong, like a perforated bowel or ulcer. In an upright chest or abdominal X-ray, free air rises and collects under diaphragm, forming a crescent-shaped lucency. As you can see in this X-ray, we can see these free airs on the diaphragm. It's easier to spot on the right hemidiaphragm because the liver provides a uniform soft tissue background. On the left, it's harder because you've got air-filled structure like a stomach and a splenic flexure of clone, so it can mimic or obscure free air. Now, if the patient is lying down, like in a supine view, free air can rise and collect in the central part of the abdomen and collect under the central tendon of diaphragm. That gives us the cupola sign, small dome-shaped area of air in the middle. As you can see in this X-ray, we can see cupola sign in this area. Here's a really important sign, the Rigler sign. Normally, we can only see the inner wall of bowel. The outside is surrounded by soft tissues with similar density. But when there's air in the peritoneal cavity, it surrounded the outside of the bowel. So both sides of the bowel wall become visible. It's like the bowel wall gets outlined by air on both sides, and that's the Rigler sign. You can see in this abdominal X-ray, we can see both sides of bowel wall in here. Just be careful, overlapping dilated loops of bowel can mimic this, something called a pseudo-Rigler sign. You can see pseudo-Rigler sign in this X-ray. It's a pitfall.
It's not advertising. It's just a friendly reminder to like and subscribe, my friend.
When there's a large amount of air and the patient is supine, that air can rise over the anterior surface of the liver. It can make the falciform ligament, which normally is invisible, suddenly visible as a thin vertical line. That's the falciform ligament sign. In this X-ray, you can see this falciform sign here. In some cases, that air surrounds everything so much, it creates an oval-shaped gas pattern with the ligament visible. It looks like a football with laces. Yeah, that's the football sign, not soccer sign. And it usually means massive pneumoperitoneum, often seen in pediatric or post-op patients. You can see this football sign in this infant X-ray. You can see regular signs here shown with a circle around the area. You can see falciform ligament here, and the football sign is this oval shaped pattern. So we've talked about how to spot free air on X-ray. But the next question is, why is it there in the first place? Pneumoperitoneum usually means one thing. Something inside the GI tract has ruptured, letting air escape into the abdominal cavity. So you can see the causes of pneumoperitoneum in this page. And the first cause of free air is a perforated hollow organ like a perforated peptic ulcer in the stomach or duodenum, or a ruptured loop of bowel, small or large. These are surgical emergency, and that tiny crescent on the diaphragm might be your first and only clue. After abdominal surgery, even if the bowel wasn't open, it's normal to see some free air for about 5 to 7 days. If the air sticks around longer or increases in follow-up films, that's when you should worry about a complication like a leak or abscess. A few other causes you should know, like trauma, whether blunt or penetrating, perforated diverticulitis or appendicitis, though these often from localized abscess rather than lots of free air, and rarely chronic carcinoma can perforate and releases gas. So remember, not all of air is created equal. The cause and the clinical context tell you whether it's a harmless post-op finding or a full-blown emergency. If you learned something today, don't forget to like, and if you're into medical learning with a visual twist, subscribe to MedInstruct. We've got more coming from radiology to internal medicine and beyond. Thanks for watching. See you in the next one.